Today was the next try for the small business relief loan debacle that ran out of all its money instantly in the first round. Today was the second round, but the Trump administration's Small Business Administration website that was supposed to facilitate the loan process today, it crashed instantly today, and the crash lasted all day long. And so that's still a catastrophe in terms of America's small businesses. I mean, the federal response has been either absent or disastrous, or occasionally, in the hands of the president, insane. From the very, very beginning, I know that I have said this before, but I think we at least have to check in weekly. We are now months into this. We're now 55,000 American deaths into this. And it is worth noting that things are not getting better. We expect in the news when stuff is exposed as scandalous and failed, particularly when it's government action that has had catastrophic bad consequences, you expect that news coverage is associated with people getting embarrassed, potentially losing their jobs, starting to work on it, and improving those systems. In the U.S. response to coronavirus, when it comes to the federal government, nothing's getting any better. Nothing's getting better over time. Months into this now. I mean, here's just one example. Turns out the CDC, a week and a half ago, put out a new list of symptoms that the CDC says can indicate potential coronavirus infection. The initial list from CDC said there were only 3 symptoms to look for: fever, cough, shortness of breath. Now they have added a bunch more: chills, repeated shaking with chills, muscle pain, headache, sore throat, the new loss of the sense of taste or the sense of smell. I mean, and that list of symptoms has ended up being a really important and utile thing in our country because we are a country where the federal government blew it on testing. And so testing has been hard to come by. Testing availability has been severely cramped for most of the country for the duration of the crisis thus far. And that CDC list of symptoms has been really important in our environment of scarcity when it comes to testing. Lots and lots of places all over the country have basically triaged testing, so only people with the CDC-defined symptoms were able to get a test. It's still true in lots of places today. Unless you've got the symptoms that are on that CDC list, you don't qualify for a test. Just assume you've got it and hope for the best. But apparently, the CDC revised and pretty significantly expanded its list of symptoms that indicate potential coronavirus a week and a half ago. But nobody knew because CDC never put an announcement out about it. They don't do briefings about coronavirus, so they didn't really have an opportunity to tell anybody. They never told anyone. They just quietly posted the new expanded list of symptoms online. And if anybody had known about it over the past week and a half, that might have made a significant difference all over the country in terms of who was able to get a test. But, oh well, did we forget to tell you we did that? When we started this epidemic, it was the CDC, it was scientists at the CDC who were giving daily briefings about coronavirus. And remember, the president shut that down because he decided they were being way too alarmist, and clearly he decided that he wanted to do those things himself. So we don't have daily CDC briefings. All other health crises of this magnitude, I guess we've never had one of this magnitude, but even of ones significantly less magnitude than this, you expect to hear from health officials every day. Now we hear from the president and whoever else he likes that day because he shut down the CDC briefings. Maybe if we were hearing from the CDC, from scientists on a daily basis, instead of from the Drink the Lysol artist at the White House, we would have heard about the CDC's new official list of symptoms, and our epidemic would have had a different course over the past week and a half.